Coming up on the Doctor's Hospital podcast.
In comparison to women, the life expectancy of men, according to the United Nations, is significantly less.
Men are plagued with anxiety and depression that are underdiagnosed, and sometimes some common symptoms that men have.
Are you seeking exceptional healthcare beyond the traditional hospital setting? Introducing Doctor's Hospital Clinics, your trusted destination for comprehensive care. Our full-service locations provide affordable services through our Loyalty Advantage membership program and NHI. Experience seamless care with our integrated health system, where your medical history travels with you, ensuring continuity of care. Book an appointment today at clinics.doctorshosp.com. We make primary care easy.
Alexis Burrows, Marketing Director at Doctor's Hospital. We are into the month of June, and we are kicking off June, which is celebrated as Men's Health Awareness Month, with a podcast on men's health. We are joined today by two of our family medicine physicians here at Doctor's Hospital, Dr. Jamico Thompson and Dr. Vashti Darling. Welcome to the podcast.
Thank you.
Thank you.
So we have a list of interesting questions that we want to go through with you guys today, just to kind of talk through some things that men should be aware of as it pertains to their health. Things like screening, things to look out for, I think touching on sexual health, mental health, and a lot of things in between. So we're happy to have you on, and we are looking forward to an interesting and engaging conversation that hopefully will end with more men signing up to do their annual physicals and being more and I'm speaking to myself, and being more willing to take a strong look at maintaining their health better. So let's start off. Can you just give us quickly an overview of what men's health encompasses, and why is it important for men to pay attention to their health?
Okay, so I'll start us off. So, health in general is defined as a state of being free from illness and injury.
Mm-hmm.
When we apply this definition to men, what we are looking at, or what this encompasses, is all things specific to males,
Mm-hmm.
whether that be mental health, sexual health, cardiovascular health. And the reason that it's important for men to pay attention to their health is because when we look at statistics, in comparison to women, the
Mhm.
life expectancy of men, according to the United Nations, is significantly less.
Mm-hmm.
So in 2019, the last statistics noted that the life expectancy for men is 71 years old, in comparison to women that was documented to be 78. This is a significant difference, especially when we compile this or couple this with interpersonal violence.
Mm-hmm.
That's been a big problem in our society. So, and in fact, interpersonal violence is actually listed as the second top cause of death among men
Oh, wow.
in our country.
Mm-hmm.
And that's according to statistics from 2019 as well. So what this lends to is a troubling scenario
Mm-hmm.
where men are considered to be an endangered species. So that's really why we want to hone in on this topic and get our men in good health.
Mm-hmm. Boy, we really be doing this the wrong way. It's like men tend to marry younger. You need to be marrying older. So we try to line up that age difference. So we all here together for the same amount of time. Okay, so I know in the family medicine practice space, obviously one of the key things that is always kind of first in line in the discussion is the screening process. So Dr. Thompson, what are some key screenings and preventative measures that men should consider for maintaining their health? And then how does that change as they age?
So during the aging process, there are different things that we actually clue in on to help with screening purposes. So I'll just go through it just broadly. So when we talk about the ages 2 to 18, we're looking at, again, chronic non-communicable diseases. So these are things that you can pass on.
Mm-hmm.
So believe it or not, as early as a young child, you can develop stuff like sugar, which is diabetes, hypertension, cholesterol problems. And it's so important to screen for those things. Dental health, vision, and hearing is going to be important as well. So these are going to impact not just the ability to chew and to get in nutrition, but also your ability to learn. And so if you miss these things, you actually can have deficits in growth that are picked up late, and sometimes the intervention that needs to happen earlier happens later. Substance misuse. So especially if you're coming down to the adolescent teenage years, as simple as cough syrup. We got people who's doping up on cough syrups, marijuana is a big thing nowadays. Alcohol misuse. And so these things can also lend to disease processes, even mental health issues in the future. Mental health. So even from childhood, you're looking at developmental problems in terms of learning. When we get older, men are plagued with anxiety and depression that are underdiagnosed, and sometimes some common symptoms that men have in terms of aggressiveness, being just withdrawn, being completely tired, may be linked to the fact that they have undiagnosed depression or anxiety. Sexually transmitted infections. We got a lot of persons who are not monogamous. It doesn't matter who they sleep with. And so screening for these are going to be important because they have long-lasting effects. So
Right.
not just on the man, but also on the partners. And then the anthropometric readings also come in play, and that's for each age group. So it helps us to know what risk factors are there in terms of BMI, for example. What is your weight? Because these things can actually affect chronic non-communicable diseases as well. So between ages of 18 to 13, again, we're focused on those things, sexually transmitted infections, substance misuse, and we're honing more on these because as you get older, there's certain things that you're more inclined to be involved in.
Right.
By the time you hit 40 now, that's when the cancer screening comes into play. And so in particular, we're looking at prostate cancer screening for men by the age of 45, colon cancer screening, and then guidelines dictate which things are going to be important in terms of gold standard interventions for those screenings. Through the whole process of life, we're also talking about the importance of vaccinations, the different ages when you need these to happen. And then, of course, your lifestyle modifications that need to be addressed, including safe self-practices, stress management that persons don't think about too much, healthy eating, healthy diet. So all of these things are very important in terms of preventative measures and screening and maintaining good health.
Okay. So, you talk through some of the screenings, Dr. Darling. From your experience, can you talk through some of the most common health issues or conditions that men encounter, and how are they typically addressed or managed?
So, to piggyback off of what Dr. Thompson would have mentioned, the screening is in line with the common issues that we typically see. So, these would include your hypertension and its complications. For example, the cardiovascular events like the heart attack, the stroke, the diabetes, the obesity, arthritis is something that we commonly see, especially as we get to that aging population. And of course, we can't miss out the erectile dysfunction and prostate health. How do we address these? How do we manage these? We like to start with basics. Knowledge is power. We can't fix the problem unless we know we have the problem. Right? So to begin with, my first recommendation is for our men to engage in healthy lifestyle habits. What I mean by that is a balanced diet, adequate physical activity. Current recommendations suggest that all persons, men and women, should be engaging in 150 minutes per week of moderate intensity exercise. So we want to encourage that. We spoke a little bit about our substance abuse and misuse. We want to avoid binge drinking. In our culture, drinking on a Friday is something that, it's a part of what some men do. Having 5-6 drinks at a time, that is what we classify as binge drinking. Although you may not have a drink every day, you're trying to make up for it by drinking all at once on a Friday evening. Illicit drug use. Okay, this is a big thing. We're looking at passing the bill for marijuana and whatnot. That comes with some caveats. So we want to be mindful of that as well. For those who engage in smoking, nicotine, we want to address those issues as well. So that's where we start in terms of healthy lifestyle. The next thing is you want to align yourself with a primary care provider with whom you feel comfortable.
Right.
As long as you have built that rapport with your patient, then it makes the process much easier.
Yeah. I mean, I think it's interesting. We've talked a fair amount in the past 2 years about the shift towards a focus on preventative medicine, primary care being a key component of that. And obviously, you can see by the resources that Doctors Hospital has placed into that space in terms of, I think we've brought in so many family medicine physicians in the last few years in an opportunity or in an effort, to make that more available to people and to give people another option in that space. I think, there's a lot of options. And I think finding someone who you feel comfortable with, like you said, because I think that's a key component. Maybe this will come up a little bit later in our conversation, but the ability to be honest with your physician. You mentioned developing rapport. I imagine that is critical because you can only treat so much, as much as information that you've given. Like, my wife is a physician and she always talks about if you don't have a good history, you kind of starting with a deficit of information.
Absolutely.
So, I think that's important to note. So going back to you, Dr. Thompson, mental health, obviously, we just came out of May, which is Mental Health Awareness Month. So we had two separate physicians on talking through from the psychiatrist and psychologist point of view the importance of mental health. And very interesting and expansive conversations on those. But we know that mental health is a crucial aspect of our overall well-being. How does men's mental health different from women's? And what are some strategies for men to maintain good mental health?
So I think the best place to start is to know that men and women suffer from the same mental health disorders. The problem is how we suffer, where the difference is.
Okay.
And so when we say that, for the most part, women tend to be more open when it comes to matters like that. So just from personal experience at the clinic, if I have 5 women and 5 men that come to the clinic in one day, I can guarantee the men are coming because there's some painful crisis is happening, but the women are going to let me know more of, hey, I'm having burnout, I'm having depression, I'm feeling anxious. Sometimes that has to be pulled from the men, so much so that we've had a few where the wife was there and the wife was the one in the visit that actually said, hey, you need to tell him you're sleeping, or you need to tell him X, Y, and Z. And so we have to realize that there's a taboo and there's a culture and there's this male machismo that we have to get past, where men feel as though admitting some of these things makes me less of a man, where we're primed to be providers and the apex predator, so to speak. And so anything that lessens that image of what a man is can be a problem.
Yeah.
So men do suffer from anxiety. Men do suffer from depression. Some persons call a child rude when the child has attention deficit hyperactivity disorder. You know, if you're missing that in a young child, that can actually progress into behavioral disorders as an adult. And so the job now comes to the physician to actually be the detective. Let's clue in as to why this man is coming in restless. Let's clue in as to why this man is being having problems in terms of libido. Why is he having problems in terms of sleep? And so could it be anxiety? Could it be depression? You know, is this a schizophrenic person? You know, the wife said, man, he's one way today and then the next day is a different story. I think I'm talking to a completely different person. You know, it may sound jocular, but if you read into that, maybe you are missing something. And so it's very important. And then mental health a lot of times is viewed as a weakness. It's often overlooked because we just chalk it up as the person's having a bad day.
Right.
You know, the person is overworked. And so if we do our job and we're vigilant with it, we can actually pick up some things that can be diagnosed and can be treated versus just overlooked, and it would become a problem in the future.
And I think that again speaks to the idea of having that rapport, right? Because I imagine you may not be able to get it out of that person the first time you see them, but as you have additional engagements, as they come for their annual each year, you know, they come because they have the cold or flu and they're seeing that same physician over and over. The idea is that you build that comfort level to be able to say, hey, well, this is another thing that's going on. Or like you said, you know, you make sure the spouse is present to kind of clue you into some of that stuff as well.
Definitely.
You mentioned stigma. I want to ask this, Dr. Darling, but there's often a stigma around men's health discussions, not just the mental component of it, right? Just generally speaking, because I think the idea is, like he said, apex predator, you're supposed to be, you know, this king of the jungle, that sort of space. And so therefore, there's a stigma around talking about any deficiency or any perceived deficiency when it comes to any aspect of being a man, and your health would be one of them. So how do we break down these barriers and encourage men to, one, prioritize their health, and then 2, seek help if they feel as though something is wrong?
So this is why I like family medicine. We do a lot of teaching, we do a lot of health promotion, and it comes back to education. Very often I have male patients who come in for an annual not knowing what to expect. By the time we're done, their usual comment is, man, doc, that's all I had to do? I would have come a long time, right? So the key is to make sure our men are aware of what a well visit looks like.
Right.
As Dr. Thompson said, you know, 5 of those patients that he sees that are men will come in with a complaint. Very seldom do they come in for a well visit. So we need to introduce that whole idea of not only going to the doctor when there's a problem, but coming into us so that we don't have a problem. And this in turn will help to alleviate the fear of building a relationship with your primary care provider.
Yeah, it reminds me of something that Dr. Hutchison, I think, mentioned, is the idea of, you know, you take your car to the mechanic. You're supposed to take your car to the mechanic, you know, twice a year to get checked out. Whether or not you hear a rattling sound, whether or not something is falling apart, you're just supposed to do that. And I think you take the same approach with your annual. You, even if there's nothing wrong, you have that well visit, and perhaps that takes away some of the anxiety and the fear, because it's like, well, I just go and I don't know right offhand that anything is wrong, so I'm just going in to see, like, hey, how is everything going?
Right.
And I think that's helpful. in demystifying what it is to engage with the healthcare for men. Because I think I imagine you both have a ton of stories about the difference between seeing a man for the first time by himself and then seeing a man after, maybe a couple of visits, and then also seeing a man with his spouse, because you're getting a lot of different versions of that man depending on either how comfortable they feel or how comfortable their spouse feels in, putting them on a hot seat. All right, so it's a great conversation thus far. We'll take a quick break, and we'll be right back on the Doctor's Hospital podcast.
Let's face it, life is hard, but your healthcare doesn't have to be. Give yourself peace of mind with LAMP plans at Doctor's Hospital. Sign up today and enjoy the low-cost advantage. Get up to $5,000 in credit limit for non-covered services and 2 free nutritional consultations. Choose your plan today by visiting doctorshosp.com/lamp. We make healthcare easy.
Welcome back to the Doctor's Hospital podcast. Again, today we are joined by Dr. Jamico Thompson and Dr. Vashti Darling, who are both family medicine physicians here at Doctor's Hospital. And we are talking about men's health as we look at Men's Health Awareness during the month of June. So I want to jump into a particular area of discussion that I think has been a crucial one. We've been back in doing the podcast for, I think, going on about 3 or 4 months now. And one of the key recurring themes has been this concept or the discussion around lifestyle choices. So how do lifestyle choices such as diet, exercise, and sleep impact men's health? And what advice do you have for men looking to improve these areas of their lives?
So it's very important. In truth, there are some chronic illnesses that can be managed alone by just lifestyle practices.
Mm-hmm.
And so persons believe once a medication starts, oh, that's it for me for life.
Mm-hmm.
So when we talk about diet, your food choice is going to be important. A lot of people think, oh, you mean I got to stop eating this to start eating that?
Mm-hmm.
A lot of times it's just balance in terms of what you eat, right?
Mm-hmm.
So whether I should stop red meat on the whole versus cut it down,
Mm-hmm.
again, is going to be based on what your goals are as well. So for example, you want to choose foods that are low in saturated and trans fats, especially if there's cholesterol problems. So nutrition labels are going to be important.
Mm-hmm.
One thing in the Bahamian population I can guarantee, the majority of us do not read those labels. And so it's important to know what carbs you're getting from the foods that you're eating, because these are going to play out in terms of your health.
Mm-hmm.
You want to limit the high glycemic foods, those added sugars, those refined grains, because those are going to cause problems. Dietary fiber is going to be good, not just for heart health, but also for dietary reasons. Ensure you have adequate water intake. I know I have a problem with that. I tell my wife when I eat my main foods, I need something colored, with it. And so I have had to train myself to say, hey, after I have that small cup of that drink, I need to make sure my next glass is going to be water. Tailored diets are necessary for good health goals as well. So, for example, if I have a person who's bulking up or trying to put on a muscle, it's not going to be the same diet as somebody who's trying to get weight loss or maintain a particular weight.
Right.
And so sometimes you may need to find tailored instructors or health coaches in that regard too. Exercise is going to be very important. Not every exercise works for everybody. And so again, you've defined the one that fits your body type, and trainers come into play. Dr. Darling had mentioned already in terms of the time that you have to spend in it. So you have moderate intensity, vigorous intensity, and it's all based on how much work you're doing in that particular time. And so once you're getting that 30 minutes minimum, 5 days out of the week with moderate intensity, or your 20 minutes minimum, 3 days out of the week with the vigorous intensity, that's a start. And I always tell my clients, you got to factor in rest time. Me starting exercising for the first time, I'm not going to jog for a whole 30 minutes.
Right.
All right. And so that 30 minutes mean active exercise. Relaxation. So I cannot understate or overstate how much relaxation is going to be important. A lot of times we get up, we work, we come home, we work, and the only thing we do is sleep. There's nothing that helps to relax the body. As simple as listening to your favorite tunes, as simple as having just a glass of wine or going out on a date, a spa date. A lot of fellas believe that spas are just for women, but relaxation is going to be really important, because stress, believe it or not, is one of the leading causes of health problems in all society. And so all of these things are going to become important. And then sleep, the body needs to reset. If you kept yourself up all night and you try to assess how your performance is the following day, it's going to be dismal. Everybody's going to report how miserable you are. Your spouse don't want to be around you. Your colleagues don't want to be around you. The patients know there's something happening. And so sleep is going to be very important to reset everything. So we can't overstate how much lifestyle choices on health are going to be very important.
Well, that sleep one keeps coming up. That it's been a consistent part of a lot of the physicians talking about so many different various health ailments. All right, so Dr. Darling, sexual health is obviously an integral part of overall health. What are some important aspects of men's sexual health that often go overlooked, and how can men address those concerns?
So, those aspects that often go overlooked, again, going back to education, this seems to
Mm-hmm.
be a recurrent theme.
Mm-hmm.
Early introduction of sex education to our adolescent patients.
Mm.
In our adolescent population, there's a segment of our consultation that we call our heads history,
Mm-hmm.
where we actually excuse the parent from the room.
Mm-hmm.
Some parents don't like that.
Mm-hmm.
Every physician doesn't do it, but it's the proper way to carry out an annual for a pediatric patient.
Okay.
That's a very crucial part of the consultation. That is the opportunity where you get to speak with the child and find out certain things. That's the point at which you're able to deduce whether or not they know what sex is.
Mm-hmm.
Have they had any experience with sex?
Mm-hmm.
Have they had any encounters that were not supposed to happen?
Mm-hmm.
That's how we hone out a lot of our SM cases, believe it or not. So starting that sex education at an early age is vital. Then we move on to our little older adolescents and we talk about the administration of certain vaccines, in particular the human papillomavirus vaccine. Okay, very often that's another integral part of the annual physical in our adolescent patients that is sometimes missed. When we look at our vaccine schedule, that one is not mandated, but it is highly recommended. And what it does is it prevents or reduces the risk, rather, of our HPV-related cancers and genital warts. A lot of the emphasis is placed on women and cervical cancer, but men can get HPV-related cancers as well, such as anal cancer, cancers of the head, neck, and throat. Okay, so we have to be very mindful of offering the appropriate vaccines to our male adolescent patients. And then finally, something that may be a little bit taboo is the introduction of a self-testicular exam. Okay. We know very well that we encourage our women to do their self-breast exams, but how many persons know what a testicular exam is or a self-testicular exam? So your annual physical in particular is the opportunity that you have to introduce your male patients to that. And that again starts at the adolescent age, such that they become comfortable and they are able to differentiate normal from abnormal. And this is another routine that we use to help to detect abnormalities.
I imagine it's pretty helpful in giving, especially your younger patients, an understanding of their body, how it works, how it's supposed to work, how things are supposed to feel, operate, all of those sorts of things. And then therefore it gives them, I guess, a greater sense of control over and an understanding of their own health. And obviously we know knowledge is power, and education is such a strong component of a lot of this conversation. And hopefully that helps to answer the next question. Many men are reluctant to visit their doctor regularly. What advice would you give to men who are hesitant about seeking medical advice or discussing sensitive health issues with their healthcare provider? Dr. Thompson.
The first thing is stop thinking about the finger exam. So listen, many men come inside the clinic and the first thing in their mind, doctor, you got to put your finger in my hip. That's the first question that comes out from them. And so what I normally do is I have a discussion with them and let them know that there's some things that are recommended. And then there's some things just for comfort purposes we can bypass a bit. And so I give some of them the option, hey, we're going to ask the questions related to prostate health. These are the things that can happen if your prostate is big. And then we can do this PSA test that lets me know if there's any problems with your prostate. And then the option is we can do the digital rectal exam because it may allow me to feel what's going on inside. Don't think of it in the way that a lot of persons in the culture think of it, but it's just a routine exam. And the other option is you can spend some money out of pocket. So we can do ultrasounds that actually tell us the size of the prostate itself. But again, these test modalities are limited. So I can tell you that you have a big prostate from an ultrasound, but it's not going to let me differentiate between cancer versus an enlarged prostate. And so ultimately, there's still going to be that specialty referral we have to talk about. The other thing is that don't think of the health visit as somebody getting in your business. Persons feel as though we just want to know things and have something on you, that kind of thing. Just like you brought the analogy with the car, our job is to make sure that we pick up things before it gets to the point where you're going into hospital. And that's probably the biggest reason why a lot of us are in family medicine. We've worked in the hospital setting, and we see how morbidity can be a result of undiagnosed pressure or prostate issues for men, or sugar and cholesterol. And so if we can pick this thing up early, think of it in light of you being around longer to see your child walk down the aisle, you being around longer to make sure that your wife is secured, home is secured, you being around longer to see your generations to come, versus that momentary insult that you think, is this oh my gosh, the end of the world kind of examination. So it's about that thought process. The other thing is there's certain stigmas that also cause men in particular to be a little adverse to healthcare. So cost, for example, they expect the worst. They think as though it's an inconvenience. So some persons talk about the long wait time. Some persons talk about poor bedside manner, depending on the doctors, that kind of thing. Some persons talk about not being able to converse or actually get a feel of what their health is because it's one-sided. And so the whole point is we're doing things locally to make it better. NHI is a big plus for a lot of persons, where you can come in and get primary care done at no cost to yourself. From a doctor's hospital standpoint, there's a LAM program that helps offset costs. And so it's like a mini insurance without spending an arm and a leg on insurance, pretty much. And then it gives you some discounts on doctor's hospital services itself. There's ways to invest in self-care devices. So as simple as getting a smartwatch. You can monitor your heart rate, you can monitor your steps. Even in terms of relaxation, you don't have to spend big money to go to a masseuse. You can even invest in massage devices, heating devices, that kind of thing. And so a lot of it has to do with, like we said, knowledge, and then lessening that stigma that men have surrounding the actual visit itself. We don't bite. We're not trying to make anything uncomfortable. And at the end of the day, you're probably going to find one of your best friends is a family medicine doctor. So.
Yeah, and obviously early detection is critical, because the earlier you can catch something, the more likely it is that you have a better patient outcome. And I think that's a key component of it as well. All right, Dr. Darling, as family medicine physicians, what unique perspective do you bring to men's health, and how do you approach the holistic care of your male patients?
So the unique approach brought to men's health is the fact that we offer comprehensive care.
Okay.
This care factors in the mental health, the emotional health, the physical well-being of the client, while at the same time building a strong doctor-patient relationship, and that encourages continuity of care.
Right. That's a big one, continuity of care.
Very important.
Because I imagine if you have a patient who's been to, Dr. 1, Dr. 2, Dr. 3, Dr. 4, just trying to gather the full picture of what their experience has been, what their actual history is, and even just in terms of having all of the appropriate medical notes straight through that process, I imagine becomes a little bit challenging.
Very much so.
But that idea of you see me and you see me over and over and over again, the rapport, the comfort level, having all of the information at your fingertips makes that whole process a lot smoother, because you can know the ins and outs of a patient. I've heard people talk about that experience of, you've had a patient for 10, 15, 20 years, and so you already know what their normal is at every stage of their life.
Precisely.
And so it allows you, even as their physician, to quickly pick up on something that looks different, even just by looking at their affect when they come into the office. I know that's a strong one. This last question I'm going to ask to both of you. But looking ahead, what do you see? We'll start with you, Dr. Thompson, but what do you see as the future of men's healthcare? And are there any emerging trends or innovations that you're particularly excited about?
So the electronic age is the biggest thing. And so a lot of persons like the ability to access something without having to leave their personal space or their comfort zones. And so telemedicine, even though it's not new, is something that's still evolving, where it's a simple phone call, virtual visit, where a consult can be obtained. There's some limitations to it, because for the most part, we can get an idea of symptoms, but we can't examine, right? But it's a source of convenience for patients. I also read an article about men's spas, believe it or not. And so when we're back to that whole relaxation part of it, the likelihood of a man to go to a spa by himself right now is limited. But if you make it a spa where you have a barber that's there, a sports show is on and you're
Mhm.
providing the man with their favorite drink, and
Mhm.
at the same time you can get pedicures, manicures, that kind of thing in one
Mhm.
setting, it would increase that desire for the man to actually go there. And
Mhm.
relaxation, like we said, is a good part of stress relief, and that
Mhm.
also helps with health. And so there's some studies that talk about persons investing into man spas for that regard. Access to personal medical records. So this
Mhm.
is something that recently Doctors Hospital actually initiated. In the public sector, it's difficult for you to have your own records unless there's a letter that's provided by the attending physician stating these are your problems, your medications.
Mhm.
But having access to your own records, you actually can see the labs, you can see the results, you can see the images, and there can still be a formal conversation between you and the physician.
Mhm.
And it also helps in terms of whether or not you have to see specialists. So you have access to these labs now, and that limits you having to try to find this person to email it to this account, that kind of thing.
Mhm.
You have it right there at the access of a fingertip. Wearable health devices, we talked about them again. So I would love to see a wearable blood pressure machine, because we have things that can check your blood sugar, we have things that can check your heart rate,
Mhm.
but we have a lot of persons where investing in a Dynamap at home is a little costly for them. So if there's a watch that can facilitate, doing a blood pressure monitor, that'd be great. Partnerships. I have come across one company that I think claimed bankruptcy, but I'm going to give them their props for this. In the actual office itself, everybody was entitled to a 15-minute break outside of your rest times and lunch.
Mhm.
And that 15-minute break, you were provided a complimentary massage at work.
Mhm.
I've never seen that before, ever.
Mhm.
And so when we talk about partnerships, bosses, persons who are in positions, actually making measures in place for the organization to help facilitate health.
Mhm.
Even as simple as incentives, persons who are getting their health checks yearly, we give you this incentive or bonus. I mean, that can be hard to sell for some people, but
Mhm.
humans, unfortunately, they work based on incentives.
Yeah.
If you want someone to do something, you reward it. If you want someone to stop something, you discipline it.
Right.
And then again, it comes to that reward programs for healthy living too. So imagine getting a discount on grocery items because you're
Mhm.
doing annual checkups.
Mhm.
Or imagine your health insurance premiums decreasing
Mhm.
because on a yearly basis, you're being screened negative for cholesterol, negative for diabetes. And so these things are going to be things that I think anticipatorily can help encourage persons, especially men, to be more invested in their healthcare.
Yeah, that's a good one because it's kind of like I know there's a general insurance company in the States where they talk about I think it's a good driver discount.
Right.
And so that
Mhm.
idea of if you're doing things the right way, if you're doing things to help your body, then there's this series of discounts that then can kick in.
Exactly.
Which is a good one because we look at the cost of eating healthy and things like that in that space, especially, and that could be
A
a
lot.
very strong incentive, if you're able to get those things at a discounted rate.
Mhm.
Anything you want to add, Dr. Darling?
I think Dr. Thompson summed that up pretty well. Pretty well.
I mean, he covered
And he
a fair amount of
covered-
bases.
He sure did. I don't know if I could come up against that, but to add to what he said, I do really like the idea of corporations or jobs becoming more involved with the
Mhm.
health of their patients, be it male or female.
Right.
I think that in itself, it promotes rather good work morale.
Mhm.
It gives you something to look forward to.
Mhm.
Some companies have a gym on property.
Right.
Okay, that gives you some motivation
Mhm.
to go to the gym.
Mhm.
I'm at work already.
Right.
Even in terms of childcare.
Mhm.
Some companies have a nursery on property that
Mhm.
decreases your stress load.
Mhm.
That takes away one less thing I have to worry about
Mhm.
in terms of finding somewhere for my child to be. So along that vein, I think that's the era that we're headed towards.
Mhm.
And I'm hoping that, generally speaking, male and female, that provides a positive impact
Mhm.
on our overall well-being and health.
Yeah, it's like a spin on the concept of you look good, feel good.
Precisely.
If you feel good, if you feel well, then you work better.
Yeah.
You give more.
Exactly.
It's a reward that goes both ways, right?
Right.
Because if you encourage and you help to facilitate healthier employees, you will get more out of those healthier
They'll be more
employees.
productive.
Definitely.
It becomes
Mhm.
mutually beneficial.
Mhm.
All right, this has been a great conversation. I want to thank you both for coming on the podcast today, Dr. Thompson and Dr. Darling. I know it's busy. We pulled you both out of very busy clinic schedules to be here, and I'm very, very grateful for you coming on the podcast.
Well, it's our
Thank
privilege.
you for having us.
Thank you.
My pleasure.
All right, and to our listeners, as always, we invite you to like, comment, subscribe, and share. And we will see you back here next week on the Doctors Hospital Podcast.
Experience the Bahamas' top provider of physical, occupational, and speech therapy services at Doctors Hospital Rehab Center. Visit one of our 2 JCI accredited facilities, where we offer optimal patient safety and quality care for your healing journey. Let us rebuild and restore your health, mind, and spirit in a supportive environment, with specially curated massage and exercise therapy services for newborns to senior adults. Doctors Hospital Rehab, where your wellness is our priority. Schedule an appointment at 302-4636 or 805-1204.